Doctor. A hyperbaric chamber is a unique and therapeutic way to breathe 100% oxygen inside a specialized device. But what are the benefits? For the answer, we turn to Dr. Daniel O'Hara of Boca Raton Regional Hospital. Thank you so much for joining us, Doctor.
Thank you.
First of all, what is hyperbaric oxygen therapy?
Basically what it is you go inside a specialized chamber where the chamber's pressurized with 100% oxygen, and that allows more oxygen to travel in your bloodstream to the areas that require it.
Okay, a lot of divers out there in this area especially. Is this the same approach that's used to treat the bends in divers who quickly resurface?
Yes, we do use hyperbaric chambers to treat the bends, but it's a little bit different physiology there.
Okay. And what is the purpose of breathing oxygen under pressure?
What happens is when you breathe 100% oxygen under pressure, it allows more oxygen to be dissolved in your bloodstream so that extra oxygen can get carried out to tissue that require the extra oxygen in order to heal.
Okay. And hyperbaric oxygen therapy, it can work with wounds as well, right?
That's correct.
Okay. And who is it that requires extra oxygen?
Well, there are certain types of wounds that would benefit from hyperbaric therapy. Medicare actually has 16 approved diagnoses where we'll treat them with hyperbaric chambers. Some of those would include diabetic wounds, wounds from arterial injuries, wounds that result from radiation, and chronic infections in the bone, or grafts and skin grafts and flaps that become ischemic after operations.
You know, we were talking earlier, NFL season's coming up. You see a lot of athletes try to use this. Is that necessarily helping when you hear about that, or how does that pan out?
No, actually it doesn't. And the reason it doesn't work is because our bodies normally will compensate for that increased oxygen. So it's effective in areas where we've lost that ability to compensate.
Okay. Is this at all dangerous? I mean, when you're talking about getting into a specialized device, can it be dangerous, or what can you say about that?
Well, there are a couple of things that we have to be careful about. The most common issue that we have is problems with people clearing their ears, not unlike being on an airplane. There's a very low incidence of people that will have seizures by breathing increased oxygen. Others can have breathing troubles if they're heavy smokers.
Okay. All right. Very interesting. Thank you very much. And you know, Boca Raton Regional Hospital sponsors our expert and underwrites our Ask the Doctor feature.
Ask the Doctor is sponsored by Boca Raton Regional Hospital, which